All right, everybody, it's the Maximize Your Met podcast. Maximize your podcast. So bad. Anyway, it's the Maximize Your Medicare podcast and the YouTube Maximize Your Medicare channel simulcast. Basically, I'm going to drop the podcast. It's available on Spotify, Apple Podcasts, anywhere you enjoy your podcast, and here on YouTube at the same time, Sunday evening in the middle of May. And so, as usual, I'm going to just proceed without editing, without slides, without a script. Candidly speaking, I don't have enough time to, kind of make it all pretty with pretty floating, pictures and stuff like that. So, for those newcomers, my name's J.O. I'm the author of Maximize Your Medicare. It has been published by Allworth Press here at the beginning of 2020. You can see my other quotes online, lots of different places in the media, whether that be, USA Today or thestreet.com. I'm also a contributor on MedicareResources.com. Excellent website, by the way. You should check it out. Anyway, today's episode, today's video is going to be just answers from the mailbag. So on the website for the book, MaximizeYourMedicare.com, it's there at the bottom of this page. It's going to be on the link in the podcast. We get lots of questions. I get a lot of questions asking me certain things about health insurance, financial planning, and then certainly about Medicare. So why don't we just get straight to it, okay? So question one comes out of Texas from Jim. He says, I'm very likely to be unemployed in the near future. I'm 58. My wife is 47. Can you help us? So the answer is yes. First of all, certainly can help. Now, Texas is a very difficult state because of the fact that it does not have Medicaid expansion. Medicaid expansion is most of the states where you can get the subsidy. And by subsidy, the formal name is something called the Advanced Premium Tax Credit, APTC. Okay. And in most states, if Jim lived in Indiana, however, that could be a very different thing. So a couple of things. First of all, if you were covered by health insurance and you've lost your health insurance, the Affordable Care Act has your back. The federal program, okay? The federal rules say that you have the unrestricted right, that once you lose other health insurance, you can adopt new health insurance. You can purchase new health insurance, okay? Now, Texas is a very difficult state because of the fact it doesn't have Medicaid expansion, you end up having to pay the full freight. In other words, the full price of the premium that exists in Texas. That is going to be expensive. I'm just going to tell you right now. Our private clients, my private clients in Texas, have a difficult time because of the cost of that health insurance. Okay. Let's say that Jim lived in Indiana. That's entirely different. Meaning that yes, you can get health insurance, you can get accepted by health insurance, and you can get the advanced premium tax credit, the subsidy to lower your health insurance premium. You need to be very, very careful because this APTC is actually a tax credit. That means in the United States, IRS, okay? Because it deals with taxes. That means you've got to be very careful about how much money you've earned so far, year to date in 2020, plus what you will expect to earn for the remainder of the year. That will determine the amount of tax credit you get, which can be used to lower your premium. Now, if this sounds complicated, there's a reason for that. It is complicated. Okay. So the way that I work on this is you send me an email, we agree on a one-time fee, whether it takes an hour, whether it takes 40 hours, one time for the household. So if you got your spouse, and 6 children, doesn't matter, just one situation. And the reason for that is because in many cases, it's going to take a lot of work, research on our end. We've got to make sure a number of dip switches are set correctly for you, for us. Okay. But from that point, we'll fulfill our financial responsibility, right? I've got the financial duty to you to act in your best interest. Our job, and I say this out loud to our clients. I say this to my clients. Look, at that point, I'm a waiter, right? I don't determine the prices. I don't control the prices. I don't control the compensation, commission, etc. Can't control any of it. All my only objective is to make sure that your household gets the efficient answer, so that you get the benefits at a price that suit your budget, your healthcare needs, that combination. That's my job from that point. In other words, I'm there to present the items on the menu. I'm not there choosing. That's your money. That's your set of priorities. Okay. So Jim, that's your situation. And for the broader audience, this type of thing under the pandemic, I don't think is going away. Right. And every week we get told by, the Department of Labor, this is not going away. Even now, this many weeks after the fact, 3 million new unemployed people a week are filing for unemployment. Those persons, if they had health insurance, have lost it. Okay, if it were provided by their employer. There's all sorts of public policy implications here. Okay, that's beyond the scope of today. Do I have opinions? Do I have thoughts? The answer is yes. Are we going to discuss it on today's podcast? The answer is no. We would have like a 20-hour podcast, and I forget it. I don't want to talk for 20 hours. You don't want to listen to it for 20 hours. Okay. Question number 2 comes from Beth in Maryland. She asks, Jay, I noticed that my benefits under my Medicare Advantage plan aren't exactly what I had hoped for, and I'm wondering if I can switch and go back to original Medicare. What do you think? So Beth, formally speaking, you can't just eliminate yourself mid-year from Medicare Advantage and revert back to original Medicare. Okay, there's your bottom line answer. You can't easily do this. Okay, I guess you could, if you had a premium, you could stop paying. In theory, that is true. Okay, now the reality is that many Medicare Advantage plans in the United States have zero premium, so you don't even really have a path to get there. The second part, however, that wasn't asked, and this is a very key component to understanding what Medicare Advantage actually is, okay, is that Beth, you've got the unrestricted right coming in October, starting on October 15th, right, to change Medicare Advantage plans so that the combination of benefits, cost, your doctors, the networks, the networks, your understanding of the networks, and your individual situation fit together. Okay? And the reason I say that is because that's the secondary stuff. The primary stuff that you need to understand about Medicare Advantage is that it has an out-of-pocket maximum limit. In other words, if you have a very bad health year, you have to continue to go see the doctor, you get hospitalized, et cetera, you've got tests, you've got surgery, you've got more tests, you got rehab, etc. There is a cap on your out-of-pocket exposure, right? And by exposure, I mean your financial exposure, right? Your bills can go up to the annual out-of-pocket maximum limit. After that, for healthcare services, they stop. The carrier and Medicare pay for the entirety. That is the critical component. That should not ever be forgotten. Okay? Why is that? Because the federal card alone, just the red, white, and blue card, it has no limit. And persons who are new to Medicare, they don't understand this difference. For adult age children who are trying to explain it to their mom and dad or trying to help their parents, they don't understand that the federal card doesn't have this limit. Okay. It just looks like, oh, the deductible's low and it's 20% copay. That's better than their private individual insurance. So just the federal card by itself is good enough. No, because it has this big hole here, and that hole is unlimited downside exposure, financial exposure, if you have ongoing healthcare costs. Okay. So, Beth in Maryland, there's your answer. The answer is no, you can't easily change and just cancel out of your Medicare Advantage plan. You can do so annually without restriction, and then again, you can even change again during Q1, quarter one. Okay, that is possible. On we go. So, third question comes from Larry in Miami. Larry says, Jay, I want to know whether or not I can enroll in Part B. I'm currently employed and covered by my employer insurance, but that employment may end, and I want to know whether or not I can enroll in Part B. In advance of being unemployed, is this possible? So Larry, for this one, again, and this is very, very common, right? Which is that the questions may seem simple. They seem like, oh, well, this is no problem. But the reality is there are many, many layers here. And this is why I wrote this book, right? The book Maximize Your Medicare is there because of the fact, yeah, can I give you a pat answer in 30 seconds? Yeah, maybe. And then the next person listens to the explanation and then pulls it out of context and takes away the wrong conclusion, presuming that it applies to you and your situation. We haven't talked about the other 10 issues here. Okay. Maximize Your Medicare is to give you like, look, it's not just that one issue. We've got multiple issues. And here's your perfect example in Larry's case. Okay. So Larry, the answer is yes. The answer is yes. Can you enroll in Part B today and be effective on July 1st? The answer is yes. And it's special this year under the pandemic. Why? The reason is that the CMS has created a special enrollment period. They just announced it. Okay? They announced it and it's retroactive. So the way that they set it is that the deadline is June 17th. You can still enroll in Medicare Part B. You'll have to pay for it. Your coverage date will begin on July 1. That's possible. So that's answering his question directly, right? I mean, that's exactly what he asked. Can I have that? Is there going to be a penalty? Are there problems? No, there aren't going to be problems. The complication here is what happens in July. Okay. Can Larry apply for Medigap? The answer is yes, because his Part B will begin on July 1. The answer would be yes. Can he enroll in Medicare Advantage on July 1? The answer is yes. Can he have Medicare Advantage and Medicare Part B and B, A and B, which must be the case, and his employer plan? Formally, the answer is no. And the reason for that is because most of the time today, on Medicare Advantage, they have both the health benefits plus they've got prescription benefits. It is not the health part which is creating the issue. It is actually the prescription portion which is creating the issue. Because under his employer plan, he has credible coverage. And credible coverage for newcomers is the specific term dealing with prescription drug plans. So he's got it over here from his employer. If he chooses Medicare Advantage, which has prescription drug coverage, right? You can't have two prescription drug plans. That's the bugaboo here. So you can see, again, it looked like it was an easy question. Let's see here. I've like lost my video monitoring. But reality is that it became a little bit more complicated. And again, this has to do with my earlier explanation that, hey, the answer looked simple. The answer, like, Pat, can I just enroll in Part B? Yes, the answer formally is yes. However, there's other follow-up questions here. Other follow-up questions. Okay. Those are 3. We're going to continue on this series, right? Keep sending me your emails with these questions. If you go to maximizeyourmedicare.com, down there, maximizeyourmedicare.com, right? There's a specific page called Ask Jay, right? No surprise, the hashtag Ask Jay. There's a place where you can send me your message. It'll only come to me, okay? You will get your answer. You'll have your follow-up. And if you're asking for my assistance, you can get it, right? If it's very simple, I'm going to give it to you for $0, right? Without charge. I'll certainly be able to. What I'm really trying to get to is to say how much work it'll take, because what ends up happening is I spend 20 hours and then you run away, okay? That part that I'm trying to avoid. If you've got just a 5-second question, I'll answer it. It's not going to be a problem. We get these questions all the time, okay? So anyway, that's it for today. I'm trying to keep it fairly short because podcast listeners, I can't have a 3-hour podcast, right? Be sure to subscribe to this channel, whether it be on YouTube, subscribe to the podcast, Spotify, Apple Podcasts, wherever you get your podcasts. I'm Jay. Hope you enjoyed today. Be sure to check out maximizeyourmedicare.com. Thanks for watching. Thanks for listening.